Let's settle for our stories. And Kasim Belkis is battling a kidney disease and goes for dialysis 3 times a week. Sometimes she's locked out of the school for being late as a result of going for dialysis at the Upper West Regional Hospital. She's a child of a single parent and depends on the benevolence of family members to raise at least 1,500 cedis for her weekly dialysis. On our dialysis crisis series today, JoyNews' Rafiq Salam met with her at the dialysis center at the regional hospital and reports there are only 2 dialysis machines at the center for over a dozen patients.
15-year-old Kasim Rais Belkis, almost a year and a half ago, was diagnosed of kidney disease that requires her to do dialysis.
It started when my baby started rising and I came to the hospital for a checkup. I was diagnosed with a nephrotic syndrome, kidney disease, and I was admitted here and transferred back to the Kolobituchi hospital. And I came back here to start the dialysis just 15th June and 11 days to 5 months today.
Since she started going to the Upper West Regional Hospital for the dialysis on June 15, she has been there 38 times, and this session requires at least 450 Ghana cedis for the treatment. The amount of money involved is too colossal for a child of a single parent.
As a single mother I'm born with, she's managing. I'm proud of her, and yeah.
So a week you come here 3 times?
Yeah, sometimes 2, sometimes 3.
So the minimum money paid is 450 Ghana cedis?
Yeah, sometimes the costs take to 1,900, just into 1,000, so we're just money.
The least amount required in a month to enable her to go for the dialysis treatment at the hospital is 5,400 Ghana cedis. Her grandmother, Amamata Ibrahim, was almost in tears, narrating the ordeal they go through to raise the money for the treatment. She has to depend on close family relations to foot the cost of the dialysis for the granddaughter.
I have been supported greatly by my family members. There are others who doesn't have such support. Our plan is even to send her to India for kidney transplant. Dialysis, you cannot afford. How do you pay for the cost of transplant outside?
Transplant. It won't afford the dialysis. In about a transplant.
Amamata Ibrahim says the amount involved is staggering and should be reviewed downwards.
15 million. Every week, 15
Every
million.
week, we pay minimum 1,500 Ghana cedis. There are even times that we come for a session which is supposed to be 450 Ghana cedis, but you end up by paying 700 Ghana cedis. But we heard government says they want to increase. 450 Ghana cedis we can't pay. And you want over 700 Ghana cedis? Do you want to kill us? Ever since we started this dialysis, at least 6 persons have so far died because they cannot pay. If I want to say more, I will end up crying. I will appeal to government to include it in the list of medication for the National Health Insurance Scheme.
A view shared by her granddaughter, who wants the cost to be subsidized or made to be free.
Because no one has money. You can't even afford a 3 square meal. So how can you afford dialysis 750 or 350? Some people, they are helping them, so sometimes they can't even afford food to eat. How will they afford the 350? People can't afford the dialysis every 3 days a week. So if they just include it in their health insurance, so you can just bring your health insurance so the government can pay part of the bill and you pay part, it will be helpful to them.
Kasim Rais Belkis just finished junior high school and waiting for her results of the Basic Education Certificate Examination BCE. She recalled the challenges she went through at the school before she completed. She was a perpetual latecomer and many occasions was locked out by the school security personnel at the gate.
And I always feel guilty. Why will I be going to school late? And the watchman, he sometimes he doesn't understand. Sometimes he will lock the gates. Why will you be an exception to come to school late? But by God's grace, I was a third-year student and I was able to write.
The dialysis center here has 3 machines, but only 2 are working. As a result, she has to wake up early on any of the treatment days in order to avoid the long queues here.
It's affecting us. We can't just be in line every day. We can't wake up 4 o'clock to be in line just to be first and go back home to rest. Why? We need more machines and more equipment for this dialysis.
The dialysis center of the Upper West Region Hospital was established in November 2022 through support from Asase Foundation. Medical Director of the Upper West Region Hospital, Dr. Robert Amesia, averred that the fee charge is for the maintenance of the machines.
But for a hospital, what we try to do is not to cash in on patients. The reverse side is, if your input cost is higher than your output cost, then you should just prepare for a shutdown of the center. And we know private centers that started and shut down. We know public centers that started and shut down. The machines use light. Now we are required to pay for light. The machines have to be serviced. You need money to service. The people that service the machines are not in YA, they come from Accra. Everything in life has a lifespan, including human beings. After some period of time, you die. These machines are not going to work forever.
Since the establishment of the center, over 5 dozen patients do come here for dialysis. Kurisa Daniel is the in charge here at the center.
We do have problems with them because you tell them what is due or what is right for them to do, like coming for dialysis 3 times in a week. Some of them default, and because of the default, some of them develop complications at the end of the day. Some are not even able to come twice a week. They come once a week, and once a week, those doing dialysis, they know it's just like you are not doing anything. And it won't take long, then complication will start, and the patient automatically, if nothing is done about it, she dies.
Reporting for JoyNews, Rafik Salam. Wow.
Well, this evening at 5 p.m., JoyNews is organizing a national conversation on the dialysis crisis. We'll also be looking for the way forward to resolving these issues. I've been joined in the studio. Remember, it's also be live on Joy 99.7. I've been joined by the head of Help Desk, Fred Smith, who is leading this whole thing. Fred, how is the conversation shaping up, and what should people expect at 5 p.m.?
Well, Aisha, this will be a prestigious gathering of experts, opinion leaders, thought leaders in this area, as the healthcare sector especially, to try and find a solution to the dialysis crisis. We don't have to belabor the point. It's a big issue in Ghana, and we need to find a way of bringing relief to people who need dialysis treatment because they have kidney problems that take them to the hospital almost all the time.
Go ahead.
They can't afford the fees being charged by the facilities, and they still need the service. So what do we do as a country? The challenges are there. So this evening, we're going to raise the issues, the challenges that came. And remember, this whole thing started because of the increase in the charges at the Kolebu Teaching Hospital. Yes, the hospital really needs the funds to be able to continue to provide the service. That's great, but people can't afford. Where do we bridge the gap between these lines?
And so I was going to ask why we've had to have this conversation. You've laid the background there. What's the end game of this conversation? Well,
at the end of the day, considering the experts that we're bringing on board and the policymakers, we expect some change in the way we administer this service to persons who need it in Ghana. We'll also find a way to help people understand how they can live their lives to prevent getting kidney problems so that we reduce pressure on our facilities. Remember, if you are not sick, it's better than being sick and being treated.
Yep.
So that's a very good point to start, and therefore we'll raise the issues, we'll try and find solution, and also advise people on what they can do, the personal responsibility that you as an individual can take to minimize this pressure on the entire economy. That's what we want to do. And I go through the guests list with you.
Okay.
We're having Kojo Bafo Ahinkra. He has an end-stage kidney failure. He's been on the treatment for about 8 years, and he needs 3 times of the dialysis treatment
in a
per week.
Wow.
But he's able to afford 2 in a week, and sometimes he's unable to afford 2, so he goes for 1. He's joining the conversation. I need to tell you who he is. He's an IT professional, so there's somebody we expect to be able to raise enough to take care of their health, but they can't. We have Thomas Vincent Khan. He's also a kidney patient. He's been on the dialysis for about 10 years, and he's going to join us. Perpetual Furama Ampofo is the president of the Ghana Registered Nurses and Midwives Association in Ghana. He's joining. Kwame Sapoesiedu, we know him very well. He's a pharmacist based in the United Kingdom, but has his eyes keenly monitoring events in Ghana.
Because he's also a fellow with CDD.
A CDD fellow as well. And we also have Professor Samson Entry. He's president of the Kidney Association in Ghana. He's also a nephrologist taking care of children. So his perspective will be very interesting going into the show. We have James Makion Amwa. James is a nurse at the Kolibu Renal Unit where this whole story started from. So we'll get to hear from him how they manage. Then we'll have Dr. Fred Adomako Boateng. He's the Regional Director of Health Services for the Bono region. That's from the Ghana Health Service representation. Then we have Dr. Anthony Insiasari. He's the Presidential Advisor on Health. All of these individuals are coming with their expertise to try and help find a solution. Who knows? We may be able to get the the National Health Insurance Authority, for instance, to put dialysis treatment on that. If they do, how do we fund it? All of that will be discussed.
This certainly will be a big conversation. I mean, no matter how you look at it or whichever way you look at it, it's going to be a very big conversation. Who can participate, Fred?
Well, all of us will have to participate. All of us. I am producing this show, but I'm participating as if I'm an ordinary member of the audience.
Yep.
I will follow it keenly because it helps improve the health situation in our country. So everyone, and here's how you can do it. It will be on Joy 99.7 FM. It will be here on JoyNews. It will be on myjoyonline.com. There will be a stream there. Then our social media platforms, if you check the Joy News and Joy FM social media platforms, Facebook, YouTube, and part of it on Twitter Spaces, will be all over.
Well, this is a conversation that you and I cannot miss. Even if you are not a kidney disease patient, you definitely have something to take out of this. So make a date at 5 p.m. It's on Joy News channel. It's also on Joy 99.7 FM. And you've heard all the people who will be discussing and sharing their expertise. We can definitely tap into their expertise and live a healthy life.